Hi, happy morning everyone. Welcome to Metier YouTube channel. I hope you are all preparing well. The exams are coming. We are nearing to the exams. Very less days only there. So don't worry. Practice well, read well, and revise well. Okay. So we'll start today's 5 important MCQ for the exam of AIIMS and JIPMER. Okay. So we'll start with a small quote. Not today quote. It's small with a small line. One line. I am impossible. Okay, we can take it in either way. I am possible, or the word itself, impossible itself, contain possible. Okay, முடியாதுன்னு சொல்லவே கூடாது. Everything is possible. Clear? Yes, we'll start today's session. We'll start today's with the disaster management and fire safety. Okay, so what does RACE stand for? RACE, R-A-C-E. So options: rescue, activate, close doors and extinguish, run, alert, call fire department and escape, rescue, aim, control and evacuate, ring fire alarm, alert, close door and escape. So what is the right option? The option is A. Rescue, activate, close doors and extinguish. Close door is nothing but confine or contain. So that means I'll show the picture so that will be useful. So this is the fire safety abbreviation for RACE, R-A-C-E. Rescue. So whenever there is a fire or a disaster in the hospital, we have to rescue the patients first. So that is important MCQ. Okay. So previous year, JIPMER and AIIMS also the same question they asked. So first one is rescue. Second one is alarm. Alarm to the fire safety department and security department. C is contain or confine. So that means the fire needs some ஃபுட். ஓகே, ஃபயர் நல்லா எரியணும்னா அதுக்கு வந்து ஒரு தீனி வேணும் இல்லையா? ஸோ அதுக்கு என்ன பண்ணோம், பக்கத்தில் இருக்கிற கேட்ச் பண்ணி போகும். இட் வில் கேட்ச் வாட் எவர் தட் கம்மிங் நியர் டு த ஃபயர். ஸோ வி நீட் டு கட் டவுன் தட் ஃபியூயல் டு தி ஃபயர். ஸோ தட் இஸ் கால்டு கண்டெயின். ஸோ பர்டிகுலர் ரூம் இஸ் ஹேவிங் த ஃபயர், ஜஸ்ட் ட்ரை டு க்ளோஸ் த டோர். ஓகே, ஸோ தட் த ஃபயர் வில் பி இன்சைட் ஒன்லி த பர்டிகுலர் ரூம் ஒன்லி. It will not spread out. That is comes under contain. Extinguish, nothing but we have to use the fire extinguisher to control the fire. So that is race. Next one is pass. What is pass? Pull, aim, squeeze and sweep. How to use the extinguisher properly. That is comes under pass. Pass, nothing but first one is P for pull. There will be a small lock or chain will be there. We have to pull the lock. Okay, we have to release that lever so that it will function. So that is the first one. Aim. We have to aim. Where is the fire base? We have to. For example, this is the fire. You have to aim for the base. Ingirundana start ayivarudhu. So the fire is from the bottom only. So always we have to aim for the base. Next is squeeze. We have to squeeze the extinguisher. So then only it will blow out. Whatever the ABC type of extinguisher, then only the material will come out. And sweep. Sweep, nothing but left to right, up and down. We have to do it. Clear? That is sweep. So this is the main abbreviations we used in the fire safety, race and pass. So according to this question, race answer is option A. Next question. After you pull the pin, aim the nozzle of the fire extinguisher at the what? So that is what we have discussed. The answer is base of the fire. We have to show the extinguisher nozzle towards the base of the fire. Clear? So we already discussed it. Next question. The community health nurse is working with the disaster relief after a tsunami. Okay. So the scenario based question. The nurse assists in finding safe housing for survivors, providing support to the families, organizing the council and securing physical care when needed. Which level of prevention does the nurse exercise? Options: primary, secondary, tertiary, quaternary. So the right option is it's a tertiary level of prevention. So what the nurse is doing after the tsunami? Preventing the disabilities. Rehabilitation measures, it will come in under the tertiary level of prevention. The last class we have discussed about the primary, secondary and tertiary. So who are not seen that video, you can see that. So tertiary level mainly focusing on the rehabilitation and reducing the degree of the disability. Clear? Yes. Next question. The nurse from a medical unit is called to assist with care for clients coming into the hospital emergency department during an external disaster. Using principle of triage during a disaster, the nurse should attend to the client with which problem first. So big scenario, nothing is there. So we have to know about the triage. So which patient we have to attend first. So that's why scenario confuse. Okay. So you always see the key points so that you can read the question very in the fast manner. Okay. So what is the scenario here? The disaster is happened. So they're given some 4 types of clients are there. So which one as a nurse we have to attend first? Fractured tibia, penetrating abdominal injury, bright red bleeding from a neck wound, open massive head injury and deep coma. Think and answer. So the answer is bright red bleeding from the neck wound. Okay. So we will, most of will think that a open massive head injury will comes. Okay, no. In disaster management, we have to categorize the patient into mainly the 4 categories: red, yellow, green, and black. Okay. Red is where the resuscitation is required. And one more thing is that where we can save the patient. Resuscitation நம்ம எல்லாருக்குமே கொடுக்கலாம். But அந்த resuscitation measureனால யாருக்கு benefit அதிகம் அதையும் பார்க்கணும். That is the main motto of the disaster management. If you are providing the care to the particular person, that should be benefit. That should be give the survival to the patient. Okay. So that's all the category will come to the red. Here the red, why? Bright red bleeding from the neck wound. So there is a profuse bleeding. There is a chance of shock and collapse of the patient. So we can resuscitate. So the survival is better outcome is there. So they are coming under the red. Next, yellow. This penetrating abdominal injury, we can wait for 30 to 60 minutes. There comes under yellow. So the 1 hour waiting period is given for yellow. So that is comes under penetrating abdominal injury. If it is a penetrating a chest injury, it comes under red. That is a different. Abdominal is second priority. If it is a chest, because the lung involvement is there, heart involvement is there. So penetrating chest injury means it comes under red. Okay. Next, coming to the green. The fractured tibia patient comes under green. Why? They can wait for up to 6 to 8 hours or 24 hours. Okay. They are comes under green. Because they can do some self-care also. Okay. Next. Coming to the black. Here the open massive head injury in deep coma patient survival is very, very less because of the disaster management. We have more than 100 casualties will be there, or more than 10 to 20 casualties will be there. So the open massive head injury survival, even though if you are giving the resuscitation measure, we cannot survive that patient because the open massive head injury. Clear? There comes under black. There, the prone for dead. So whatever the measure you will give, we cannot resuscitate that patient. Sorry, we cannot expect the survival. Okay. We can give the supportive care only. That too after red and the yellow patient only, we comes to the black patients. Clear? Yes. Next question. Question number 5. In conducting a primary survey on a trauma patient, which of the following is considered one of the priority element of the primary survey? So we have the primary and secondary surveys are there. I'll show the picture so they can answer this question. Oh, you have seen already. Okay. So the answer is B, brief neurological assessment. I'll show the picture. We have primary, secondary, and tertiary. So main 2 is primary and secondary. Primary is nothing but A, B, C, D, E. A for airway and C spine control. B for breathing, C for circulation, that is hemorrhage control. D is disability. In the disability, we will do the brief neurological examination. Okay. Next, E, exposure and environment. Okay. In some hospitals or some extents, D and E will come under secondary, but in most of the primary hospitals, the primary survey, the mini neurological examination comes under primary only. Okay. Secondary is nothing but we have to clarify the history of the injury and we do the vital signs and the allergy, medications, past illness, everything we will do the assessment. That is comes under secondary. Okay. So according to this scenario, primary survey is nothing but brief neurological assessment, the level of the consciousness, pupil reactions. Okay. Got it? Yes. So today's class was, I think we completed the emergency little bit. Okay. It was helpful for you. I hope so. We'll meet in the next class. Thank you all and all the best.